We probably can get started. I have heard that Liz is not going to be here, so we expect her. And then we have Bruce and Todd coming in late. So welcome to our meeting of the Grants Program Committee meeting. And I will start with introductions, starting with Pat.
Good afternoon. My name is Pat Kimmel, and I'm a recovery advocate, as well as someone retired after working in the field for 30 plus years. And I am the current chair of the Recovery Council. Welcome.
Gordon.
Gordon Smith, I'm the state's director of opioid response, and I sit on the council as one of the two appointments of Governor Mills.
Liz.
Hello, sorry for my tardiness. Liz Blackwell-Moore. I'm the Director of Public Health Department for Cumberland County Government. Thanks.
Great, thanks. Chastity.
Hi everyone, Chastity Toole. I use she, her pronouns, and I'm the Northern Maine Director of Harm Reduction Services at Maine Access Points.
Kina.
Hey there, Kina Thakrar, infectious disease addiction medicine doc in Portland, Maine.
Courtney.
Hello, everybody. My name is Courtney Gary Allen. I'm a person with living experience of substance use and serve as the co-vice chair for the Maine Recovery Council.
Great. Mary.
Hello, I'm Mary Coyne. I am the coordinator for the Maine Recovery Council. I look forward to having you all join us. Thank you.
Ella.
Hi, my name is Ella Capin. I use she, her pronouns, and I'm with the Attorney General's office as a research assistant.
Great. Haley.
I'm Haley Tranco, not a council member. I'm with the Attorney General's office.
Great. And now I'll introduce our guests. So Sue, go ahead.
Hi, I'm Sue Powers. I work as a consultant with Maine Community Action Partnership, providing support to community action programs and Head Start programs across the state in their whole family work.
Excellent. Ian.
Hey, good afternoon. Ian Yaffe, Director of the Office for Family Independence here at DHHS.
Great. Welcome, Ian. And I'm Joe Everett, the President and CEO of the Opportunity Alliance in South Portland, and I'm a member of the council and I chair the Program Grants Committee. So welcome to our meeting. Just a couple of housekeeping items. Last meeting was fast and furious, and Chastity was in the car, so we will get the minutes from that meeting to folks in the next few days, and then we'll approve them all at the next meeting. And our agenda is slightly modified. My apologies for the error. We're not having folks from Scottsbluff County this meeting, and we can talk more about that at the end of the meeting. But today's meeting is going to be very exciting. We're going to be talking about the Whole Families program, and we have Sue, who introduced herself, and Ian. We're going to be joining the meeting, and then we'll move into the application process and then next meeting conversation. So any questions before we start? And with that, I will turn it. Oh, go ahead, Gordon.
Just in case there's a rush at the end, I wanted to know, I did meet with the board up in Piscataquis last night by Zoom. I met with the other board this morning. And so they are all set to come. I believe we have a meeting on March 5th.
Yeah.
From 2 to 4. And I've worked with them and they are available to present at that meeting. I hope that will work out, because then we might be able to take action at the council meeting in March. Thanks.
Perfect.
Did you guys want to go back to 2 to 4 for the March meeting, or are you doing 3 to 5 again?
I think it could be 3 to 5. I think that works for folks. So we'll do that. And while we're talking today, I'll get the agenda to you. Mary and I have looked at that, and we'll get that to you, Haley.
Awesome. Thank you.
I'll turn it over to Mary to welcome our guests and move into the agenda.
Wonderful. Thank you. Ian and Sue, we really appreciate having you join us to discuss a little bit more about your work and your programs with the committee. As you both know, the council has voted to award funding to whole family services across Maine to help in our prevention efforts, and specifically to support youth as well as families as a result of the opioid abatement funds. So if Ian, it would be great if you could start off and share a little bit more about the Office of Family Independence. Just a general overview would be great to start. And then if you could discuss a little bit more about some of your whole family service programs, that would be wonderful.
Sure, that sounds good. Thanks for the opportunity to join you today. So quick summary, OFI sits within the Department of Health and Human Services. We do a lot of different things to help connect people to services and programs that foster health, safety, resilience, and opportunity. Those include major programs such as Medicaid or Maine Care, the Supplemental Nutrition Assistance Program or SNAP, and Temporary Assistance for Needy Families or TANF, public assistance programs. And then we also have some programs that, come out of TANF, including Aspire, Hope, and then Whole Family Services for the point of this conversation. A couple other things that OFI does include we have a division of support, enforcement, and recovery. We're Maine's child support agency. And we also do disability determination services for people that are applying for medical eligibility for federal Social Security and supplemental security income disability benefits. But that's kind of a high level overview of OFI. I can definitely kind of go more into whole family services unless folks have questions about OFI.
I've got a quick question, an easy one. How many employees, Ian, do you have over there?
How many employees? Legislative headcount is around 825. And we have a number of limited period positions on top of that too. And that, we have, I think, roughly 400 to 500 people are sort of in the eligibility side of the house. So people who are either, we have, people who are actually making eligibility decisions and meeting with clients to get them eligible for benefits. We have a large child support enforcement staff, disability adjudicators, and things like that. And then, in the central office, that's where we have all of our program managers that oversee all these different programs. But the overall headcount is 825 with a large number of those folks dedicated to, eligibility decision making.
And then is your central office at 109 now?
Yep.
And how many district offices around the state?
16. We have staff in any DHHS district office. There's OFI staff are there too.
Thanks.
And one quick thing before we start talking about whole family services that I just wanted to sort of clarify, and maybe this has been clear for you all along, Ian. Thanks. Anyway, I'm sorry. Thanks for coming to you, Ian and Sue. One quick thing is that I think part of the funding was really for direct flexible funding to families, with perhaps through the whole family services. So I just want to clarify that the money wasn't for whole family services, but for direct flexible funding for families that might go through whole family services. So I just wanted to make sure was that what your understanding was as you're coming into this conversation, sort of as we think about how that might fit into the umbrella of whole family services?
Yeah, thanks, Liz. My overall understanding was a desire to provide flexible funding to support whole family services broadly, but not with a lot of, direction yet on what specifically the committee was looking to see. So I think for purposes of the conversation today, what I had imagined was that I would hear about some of those goals that the committee and the council has. And then we could take those back and come up with a more clear memo or proposal for
You do know now that the contracts will go directly to the agencies and no longer filter through the state. Because we've found a glitch that says we can't transfer those funds. So the programs now will have they won't be amended to the contracts of the existing contracts. They will be direct contracts with the council to those agencies doing whole family service programs.
Think, Pat,
Ben
and
might
and
have
don't,
to,
yeah.
oh, go ahead, sorry.
Well, I was just gonna clarify, and I'm always hesitant to even clarify our chair. But I think it's fair if Ian's hearing that for the first time, that he understands that the glitch that we found, that we don't have the authority in the current budget to give money from the Recovery Council to a state agency or office or department. That is being hopefully fixed in the supplemental. So
Yeah.
it won't always be the case, but at least for this first round of funding, we'll be doing our own contract. Thanks.
Thanks, Gordon.
And I'd have to follow up with Ben. You know, I see in the supplemental budget, there's $1.7 million in the TANF line for OFI from the Maine Recovery Fund for the current biennial. So we could follow up on that, but it could be that the supplemental fixes this for the current time period, not just going forward, but assuming that we weren't going to get money out the door before July 1 anyway. But Ben can correct on sort of what the supplemental budget does, but I see the language in there. And it's for the, you know, as soon as that passes, that gives us authority in the current fiscal year as well as the next fiscal year. But I know as much as what we've talked about today and what I see printed in the budget.
Courtney,
Ben's
hands.
the only one that could answer that, because that is inconsistent with what we believe is the case. Let's have Ben answer the question when he can.
I'm not speaking for Ben, but I do remember Ben talking about this being one of the ones that he was going to put in the supplemental budget language, because it's not like we need to do this tomorrow. This one was like, we can do this when the time is right. And I think Ben can clarify that, but that is what I remember.
And Sue is also here to talk about CAP's greater role in whole families. And the CAPs have been doing this for years. So I think hearing from both Ian and Sue is going to be important today. So go back to you, Ian. Sorry about that.
Yeah, no worries. I mean, definitely defer to Ben on whatever the ending answer is there. And either way, the supplemental budget is not law as of today. So as of today, I think the conversation still applies either way. And so, I mean, Joe and Sue, so for everybody else's awareness, I've been at OFI now for just over 4 months. So I think Joe and Sue have more experience than me with whole family services now. But I'm happy to provide a brief overview. Our program manager for that program wasn't able to attend today, but certainly in future conversations, we can have the rest of the team here. But essentially, whole family services began, at least at the OFI level, in September 2021, and they're multi-generational coaching programs that invite both parents and children to partner with a family coach who offers referrals, resources, planning, and advice to families who are working towards stability. These programs were created through legislation in 2019 that allocated $2 million annually in funding from the TANF block grant. And families are eligible to receive whole family services if they have income under 200% of the federal poverty level and if they have dependent children. We currently contract with 11 service providers who operate whole family services programs in all 16 counties across the state. Those are the 10 CAP agencies, as well as Maine Immigrant and Refugee Services in Lewiston as the 11th agency. couple of quick highlights in terms of the last fiscal year that was completed. Overall, whole family services programs partnered with 636 families that were supporting around 2,000 people. Enrollment fluctuates throughout the year, so we generally don't have 600 families at a time. It's typically somewhere in the 300 families who are simultaneously enrolled, and the total statewide program capacity at any given time is about 400 families. So that's based on the number of family coaches that are assigned in the program, and then kind of working with 14 to 25 families at a time. Trying to look at anything else that I thought might be helpful. Perhaps support payments is useful. So in the last fiscal year, we, provided just around $22,000 to Maine families for one-time expenses that they had. And those, the primary areas were either housing, vehicles, and then child development and childcare related expenditures. So I'm trying to think of anything. I'm happy to answer more questions that you might have, but that's kind of a high level of, what whole family services is and who some of the partners are that are implementing those services.
Gordon,
Thank you, Ian, and I want to make sure I heard this right. That $22,000 is a total aggregate number. It's not what you've done per family or anything. That's just
Right.
all the families. That's the total.
Yeah, that's correct. I don't know what that is. That's not there's a ceiling for that that's higher in each agency's contract. I think the number that I remember is that each agency had around $5,000 in their budget that could support those payments. So we're not actually hitting the total possible number of support payments yet. But that is a, aggregate number for the state per year.
Thanks, and it's possible that Sue would be a good person to answer the question of why with so many needs across the state would each cap agency not be getting that money out the door? But again, that sounds more accusatory than I want it to be. We're just trying to get information here. Thanks.
Ian, do you want Sue to sort of, maybe Sue could give an update or provide an overview, and then you guys could sort of answer questions together?
Yeah, sure. And then, to your point, Gordon, I think some of it, there's a lot of emphasis on, helping people navigate other public assistance programs. And so, some of the answer is in, helping people qualify for other things and having these be really small one-time supports for when people don't qualify for other programs like HEAP and TANF and general assistance. And, the program's also new, and I think it's probably hard you could probably spend that $5,000 easily once per family per year. And if that's the total for, there's for the, 25 plus families that you're working with, it can be hard to split that and still have it be meaningfully available. But happy to hear more, either from Sue or Joe on, what you're seeing on your end about that. The only other thing that I wanted to pass for this group, in case it was useful, trying to find, I can't find the exact language, but we collect a lot of data under these programs today. And the number that I remember seeing when I talked with Mary was that somewhere around 30% of whole family services families reported connection with substance use disorder. I don't know exactly what the question is on a survey that generates that, but certainly there's some connection there.
So Sue, why don't you provide an overview of the caps?
Sure, I can do that. Thank you for having me today. And Ian, the information that you gave, I just would like the group to know that the CAP agencies and the whole family TANF, the funding that we each have, either through TANF or through other sources, complements each other, and we really use it to work together to broaden the reach of our whole family work. Which has been wonderful to be able to reach families that may not have for one reason or another fallen into the TANF funding stream. So back in 2022, Maine Community Action Partnership applied for federal congressionally directed spending to broaden whole family approach across Maine. So there's a bit of difference between looking at whole family through an approach lens and looking at whole family through a funding lens. So the funding supplies the resources that we need for coaching and for those support services. The approach piece is more of a training for team members on how to work with families in a whole family approach. And the MECAP approach was to really build that capacity through staff development and to support community action agencies and Head Start programs. So in Maine, we have 10 community action agencies. 9 of the 10 are Head Start grantees. And then there are 2 freestanding early care programs that are Head Start grantees, Promise Early Education in Lewiston and Southern Kennebec Child Development. So we brought those 2 freestanding Head Start agencies into the network of support as we were rolling out the congressionally directed spending, which we received. So as we were looking at that staff development, we took the Aspen Ascend whole family core components and really modeled our training around those core components. And I'm not sure if the group is familiar with those, if you're interested in seeing more about that, but I do have a slide that I can share with you if you're interested. And then we looked at the Prosperity Agenda's family-centered coaching curriculum as the model that we would use as our training curriculum for team members. At the beginning of our 2022 congressionally directed spending period, we had in the entire state of Maine, we had 97 team members who were trained in providing services in this strength-based approach. It's a strength-based, family-driven approach to working with families. And we had 487 families, and those families are above and beyond the families that are enrolled in the whole family TANF funding stream. Those 487 families were receiving their services in a whole family approach. So that model was being used with 487 families. At the end of year 1, which was August 31st, we had trained an additional 292 staff members in the model and in the curriculum. And we were providing services in a whole family approach to 1,117 families. So we more than doubled the caseload of families and tripled the number of team members across the state of Maine that we have providing services in the Aspen Ascend model of whole family using the Prosperity Agenda's family-centered coaching curriculum. So the program is expanding and it's growing through the professional development that we've been providing team members across the state of Maine. Are there any questions so far? And I will continue on if not, but I see some hands going up.
Gordon and then Courtney.
And that's fantastic. I know very little about this, so I'm learning a lot. But I'm wondering, of the families that you're working with, do we know, and I know how hard this is, but do we know what the denominator is? How many families do we think could benefit? You know, are we reaching one family in 10? So there's really 10,000 families out there that need this, but we're getting to 1,117. Or do we really have any ideas?
So the common denominator really needs to be that the family is in a position and is ready to start working on building capacity within their family to really change and break generational trends within their family, because we do find that most of the families that we're working with, most of the families that are really struggling, it's generations of trends within the family. It's what they've learned, it's what they know. So really we're working to break those generational trends and really set a new framework for the family. The family has to be ready to do that. So even though we have 10,000 families out there that are needing the service, the reaching those 10,000 really takes time. And part of the approach model is to really have people in position. So as people are coming through our doors, those people that are in position are able to have conversations and ongoing conversations, continued conversations about the differences that working in this approach make. And it is a process. It's not a quick fix. We see baby step outcomes from month to month, and then we may see nothing for a period of time. The family may still be working with us, but it may then be that there's a leap of, I'm going back to school. And we really are looking at bookends of the approach. Am I able to share my screen and I can share this?
Yeah, I can promote you to a co-host and then you can.
Okay, thank you. Are you able to see that?
Yes.
Okay. So this is what the Aspen Ascend model of whole family approach looks like. It's a mindset. It's a way of working. It's a way of approaching our conversations with families. So we're really looking at 6 core component areas: early childhood education and post-secondary and employment pathways are really what we call the bookends of whole family approach. So we're working on one side with the youngest members of the family. We have added the K through 12 COG as well. So we do provide services within that age group as well. That is a new piece to the model. But these education components are the bookends. So we need to be looking at how are we making a difference for children in those really early years, early brain development years, to really make connections that are going to be lifelong, lasting connections. And then with the parents and the older members of the family on the other end with post-secondary education, credentialing programs, employment pathways. So looking at how do we work with families who may be employed, but have potential to increase their income by moving up within their companies or moving up within their careers. And then, of course, we surround those two bookends with economic asset building, so financial literacy, housing, home buyers education, transportation. One of our biggest barriers in I think all areas of the state, certainly in rural areas, but really building those economic assets. The number of families that come to us and have never had a checking account or a savings account, and really helping them to understand how to do that, building FDA accounts. And then we have the surrounding with health, mental health supports, health and dental health supports to all family members, and building social capital. And one of the things that we've talked about over the last few years is really social capital is one of those pieces that can really help a family project into the community, become contributing members to their communities. And how do we help them to build those networks and build that capacity to advocate for themselves, to make change in communities, to become members that are contributing and participating in events. Something that many of the families that we work with on a regular basis have not done, but it really can make the difference to success into the future for families to really build those networks and those connections. So these are the 6 core components of a whole family approach. And we do look at it as a mindset, changing a mindset, changing the way that we are working and we're approaching our work.
Thank you, Sue. That was really good, really helpful. Gordon, do you have any further questions before we move on to Courtney?
Actually, I do have one, maybe what Courtney was going to ask, but do you know of those 1,011, 17 families, what percentage generally of these families have been impacted by substance use?
I don't have, Gordon, that exact number with me today. I think Ian's number of 30% was pretty accurate. It may not be direct to the family that we're working with, but they may have past experience. They may have trauma that they're facing from early years of living in their former family. But I think 30% is probably a pretty accurate number.
Thanks.
And Gordon, that number was larger at TOA. I mean, now we provide support to a lot of new American families that don't show up with that, but the number is probably 30% still. But it was probably greater in the day. Sue, do you know off the top of your head, if we were at full staff, how many Head Start slots we have among all the Head Start sites?
I think it's close to 4,000.
Yeah, so I was going to say 4,000 or 5. Yeah, great. So Courtney, Pat, then Liz.
Thanks, Joe. Hi, Sue. Thanks for coming. Could you help me understand how the CAP agencies do direct flexible funding? As I think that's what we voted on the money being used for. And can you just walk me through the process? Does the people that get the direct flexible funding from you have to be a client and have to do certain things, or can you just help me understand?
So it would depend on the funding source and the regulations that are connected to the funding. So we, in CAP agencies, the CAP agency I'm directly associated with, we have 40 different program areas, service areas. Joe, I'm guessing in Southern Maine has probably more than that. So what we do first is we look at the program areas or the service areas that a family may be eligible for, may qualify for, and what direct service funding is available through those funding sources. And then we work down from there. So if the family is working with, say, a workforce program, and through that workforce program can access direct service funding for interview clothes and transportation and such, we would access that first. If the family is not interested, and this happens often, the family may not want to enroll because of the other expectations around the program. So then we would look at what is the next level of programming that that family may be interested in or eligible for. And then we work through all of those other program areas until we get to an area, a program service where that family is comfortable accessing the funding. And we're able to provide it. And again, not all funding sources offer direct support in ways to support families through this whole family process. Does that answer your question, Courtney?
I think sort of, but let me try this. I'm a person in early recovery. I'm working on getting my kids back from Child Protective Services. I have no access to TANF or any other funding source, but my car is broken down and I need tires so I can go see my kids for visits or something like that. Could a person like that, or would it be possible if we made this funding available in that way? Could a person go to your CAP agency and say, here's my scenario, can I apply for $250 to get tires on my car? Because
Yes.
I thought that's what I was voting on, and I'm hopeful that it is.
So yes, so different CAP agencies have different systems for accessing, but every CAP agency would have the ability to support a family in that way. I sit in Aroostook County, and the way we would approach that in Aroostook County is that we have navigation services. So if a person walked through the door and was the scenario, if you walked through the door in that scenario, you would sit with a navigator, and the navigator would talk with you about what it is you need, and then would be able to support you with a flexible funding stream of some sort to access your need. And if we did not have the flexible funding source within the CAP agency, we would work with outside agencies, outside community partners to access that.
Okay, so it is possible that the funding source that we're providing to you could be structured in that way, that mom could walk through the door of a CAP agency and say, I need tires. Can you help me?
Absolutely.
Okay.
And Courtney, one of the important reasons to have Sue here today is that we want this fund to be as flexible as possible. So Sue explained the multiple streams of funding that CAPs get now. So this needs to be as flexible as possible, because that example you just cited is pretty common.
Yeah, and
And
that's
people
what
are
I
like-
thought I was voting on when we voted this in, and that's my hope for this is, like, I come across mom and she needs tires, I can send her to, I don't even know what the CAP agency is in Augusta, but KV CAP, is it KV CAP?
Yes.
There we go. So I could just be like, go to KV CAP, they've got $250 for your tires and you can visit your kids on Saturday.
Yes, that it is possible for us to distribute flexible funding in that way.
Okay. I guess that's a question for the rest of the council. Was that the intention when we voted this in?
That's my understanding.
It was my understanding.
I think
I think-
also my understanding, and I think the purpose of doing it this way is that it also could get connected to people who are already getting parenting services. Because the idea of, and people who are parents, and the idea of this being that of being a part of prevention and not like a part of the person's treatment and recovery, which are important things. But I think the way that this money gets put as prevention is that we know that children who grow up in a family where the income is below the poverty line, their outcomes are just generally, for health and well-being and substance use, are generally worse than any child who's wealthier than under the poverty line. And so the point being that we are trying to help folks have that economic stability to be, and also that they're then accessing all these services while we're also helping with economic stability. And then I hear you on the people asking the question about like, well, how many people are impacted by substances that they serve? But I guess if we're talking about this as prevention, they don't have to have had substance use in their family for this to be an effective prevention activity to provide direct, flexible funding to families, because families that are struggling and have an incarcerated family member or who are already qualify for TANF or other services, we know are at much higher risk. Those children are a much higher risk for substance use disorder, and that economic stability is really important. I think that's how it fits into prevention, regardless of whether they have been touched personally by substance use disorder.
I love that, Liz. That you're absolutely spot on. And I love that approach.
And I would just say,
in our work. I'm sorry.
I just want to sort of make it real, Courtney, to your question about flex funds and how fast the money goes. Since the summer of 2020, TOA has spent $500,000. I mean, we had a huge fund when our CEO, Mike, retired. We've spent most of that. That was like $300,000. Most of our community services block grant money went to flex. The extra money we got went to flex funds. We have all kinds of flex funding and it goes out the door. So like this amount of money will go out the door in seconds. And I think, it is a whole families program. So we want to sort of help, like what the example you gave, Courtney, is like that gets people in the door. And then often we can really help them with their needs, but the money goes super duper fast. And I see Sue nodding her head because it goes out the door so fast.
Families right now are just struggling so badly with trying to make ends meet. And even with all of the supports that they have coming into their families, it's not meeting the basic need in many cases. So absolutely, we have families that are 200% of federal poverty that are struggling. And if we can help, if we can help with an electric bill or with a tank of fuel or a box of groceries each week, it just makes all of the difference of that family being able to actually get by for the week and feel like they're not just in a deep struggle.
Exactly. Pat and then Liz, I think, is your order. So Pat, you want to go ahead, and then Liz.
Yes, so mine is, thank you, Sue, for that explanation. I didn't know a lot about the program and feel like I know something now. I do want to share that along, I think, with others, that my vote was that this money be for flex dollars, that they didn't have to join something or be part of something. It was really a place for people to go when they were in crisis, whether that was a rent voucher or whether that was tires for the car or something. So again, that was my intent when I voted, and I think I hear other people, that's what they wanted. And I hear that you have experience with that with the CAP agency, so that's great. I do have a specific question about your program. You kept referring to people who wanted to be part of it. I was just curious. It's just a curious question. If I'm a young mom with kids and I want to be part of the whole family services, but my partner is actively using, would I still be welcome?
Oh, absolutely. Absolutely.
Thank you.
And we would take an approach of working with you in hopes that we can make change for your partner. But if that never happens, we continue to work with you and with your children.
Thank you.
Liz,
Thank you. Thanks. I'm wondering, Sue and Ian, maybe this is a question for both of you. I'm wondering about just evaluation and what kind of evaluation happens now, and if we think there would need to be any additional evaluation that you think could be helpful for I mean, I think what you're talking about, like how important flexible funding is, Joe, how you've mentioned it goes out the door really fast, but it's also incredibly important. And so I feel like there isn't enough understanding of how impactful those small amounts of dollars can be, and that we have this opportunity to perhaps with $1.4 million to add a little bit of evaluation to it to see what kind of impact it's had. And so I don't know if you have thoughts on like what evaluation is currently happening and if there are ways to kind of piggyback on some of the evaluations happening. I know John T. Gorman has been looking at 2-generational approaches and flex funding for families, and whether that would be possible or whether we should consider other methods of getting evaluation of a project like this.
Ian, do you want to talk about that from your TANF approach?
Yeah, I think that's one of the important maybe distinctions in the conversation. I'm not sure that it really matters for the funding, for the one-time funding here, but there is, sort of like the whole family approach that Sue described, which is broader than what the department considers to be whole family services under TANF. And so for the TANF side of this, we do, there's already a lot of data collection involved. And so I think when we look at sort of ultimately the approach, what matters here is that families are, achieving outcomes that they determine. And so, for us, that might look like, families accomplishing goals in 2 or more of the areas that Sue described would be something. But really it's that individual plan that they would make with a coach and what those goals are, and if they're achieving those goals, that we sort of count as success, not necessarily, the number of people that are, having adequate childcare, what the education pathway looks like for them. We track those things too, but I just wanted to reiterate that the goal achievement at the individual level, as determined by a family with their coach, is sort of what is most important in this model. And so on the, TANF whole family side of the equation, we have a process in place to collect information from all of the partners, and come up with like an annual report. And so I think, and that includes evaluating sort of like what were the responsiveness of staff, people's feelings of being, self-confident, feeling like their coach is a partner, seeing income increase. There's all sorts of different ways to figure that out. But we have that sort of infrastructure in place, and you could, wouldn't be a big lift to figure out, what the impact of additional support payments would be And then I'll pass it over to Sue, for other thoughts. And then I had one other question for the group after that.
So CAP agencies work very closely with Tim at TANF Whole Families on data collection. We have a data collection system. It's called Empower. It's a software system that each CAP agency in Maine participates in. We've just brought the 2 freestanding Head Start agencies into Empower, so we're all collecting our whole family data through the same process. The whole families, enrolled families through TANF are tracked separately, so we are able to collect really clean data on those families that we then provide to Ian's people, Tim particularly, to provide that amazing report that he year 1 report was published and was just a great report card of the work that happened in 1 year. And I know that year 2 data has, excuse me, has been collected. But Ian does have access to that report for the group. And it does have some great data in it. So we continue to collect that data. One of the successes that we have had in year 1 is that every CAP agency in those 2 Head Start programs have actively been using Empower to collect their whole family data. So we're hoping that our plan is at the end of year 2, we will be able to look at whole family work across many spectrums to provide that data. And one of the things that we have been able to provide through Empower, the data is as good as what's entered, right? And in agencies that are really tracking income and benefits of families, we have really been able to see how the change in educational attainment and employment career lattice pathways have really made a difference for families and you can watch in the reporting of families how as benefits decrease, as income increases, benefits decrease. But again, that's a conversation I think that is for another day altogether, because then we have the cliff effects that families are dealing with. So like I said, another conversation altogether. But we are making a difference through the approach. So the work that Tim and Ian are doing with the TANF funding and the work that we're doing with the CAP funding and the CAP approach, we're making a difference for families, and families are reporting that difference, but the data is also reporting that difference. There's so much that I want to say, but I don't want to take up your whole meeting. So we do a Crisis to Thrive evaluation. We provide the form, the family does the evaluation. Very often we find that families will come in and complete the assessment, and they'll rate quite high on the assessment. And then 6 months later, after a relationship has been developed with their coach and they've really had conversations and they've thought about goal setting and where they want their family to be, their own self-evaluation starts coming down, and they realize that they have work that they need to do to really accomplish the goals that they want for their family. So it's great work. It's about relationship building. And it's about making long-term change to really change that generational framework that's been built for so many generations for many people.
Great. Miles.
Hi everyone. Sorry I was late to the meeting. I was just coming out of work. So, and I also want to apologize. I missed the December meeting when everything was voted on. So I'm just a little bit behind. So first question for the group, for the Recovery Council. So this was voted on for the prevention piece, to allocate some money to the CAP agencies. Is that correct?
That's
Well, it
right.
was to allocate direct flexible funding to families with the idea that the CAP agencies could be the place where it gets to them. We didn't know exactly where. I think when we were voting on it, it was to vote for direct flexible funding to families.
Okay.
And the idea is that through the CAP agencies, it could get to the families.
Okay. Okay, that's good. And I'm all about flexible funding. My only concern is that, and I understand the prevention piece. I want to see that, I want to make sure that that this funding is used for people that were affected by opioids. So I'm wondering if there's some sort of, um, maybe not program or questionnaire, or the funding be used, like I said, for some families that were affected by opioids. That's my only question, concern. Yeah, and I'm not sure how that works.
I don't think that was the part of the stipulation, Miles. I understand that you have a desire for that to happen, but that wasn't part of the stipulation. I think under prevention, part of supporting families who are struggling, the idea is that children who are in families that are living well, in poverty are at much higher risk for substance use disorder. And so being in a family with economic stability is part of a holistic view of prevention. So I think, yeah, I see that, Haley. Those aren't the words I said. So I'm not sure how to remedy that. It was direct flexible funding to families through organizations implementing whole family service programs.
Oh, okay. That might be like what the minutes reflect. I was just going off of what the vote said, the motion said. But I can look at the minutes and see.
Okay. Thanks.
So I think, that again, Mary's going to talk more about contracts, but we can have contract language with folks. So Miles, I know for TOA, what your hope is, unfortunately, our reality, because of where we're located. We have a lot of people impacted by the opioid epidemic. I'm not sure what that looks like statewide. I think that it's sort of, there's incongruence with flexible funding and data collection. So if someone comes into Courtney's example, I don't know if you had arrived yet, Miles, to get tires, like we're not really getting that much data. We're helping the family in the moment. But we know a lot, the CAPs know a lot about our families and our communities, but we're not, it isn't like in a year we could say, oh yeah, these are the numbers. Because this flexible funding would not necessarily be managed that way. Because it's really about getting help to people out the door as quick as possible, is my recollection.
And that makes sense. And I understand, getting money out to families, and there's lots of families who need funding. I understand the prevention piece. I unfortunately missed that December meeting vote. I just wanted on the record, I am not in agreement with funds going out for families not affected by the opioid crisis or by opioids in general, or I'm just want that on the record. Thank you.
Thanks, Miles. Gordon.
Miles, before you come on, I did ask a question about how many of these families were impacted by substance use, and the answer was roughly 30%.
30%. Yeah, no, I heard that one. Yeah.
But the reason that I can go with this is that it bridges two of our four pillars. some of this is about recovery support. Some of it will get to people who are really in their early stage of recovery and just need help to get their driver's license back, get the car fixed, do something with their children. So that's really critical. But for those that are dealing with childhood poverty, housing insecurity, all the things that we know drive trauma in kids and make them at higher risk, we're into primary and secondary prevention. So I think it bridges a little bit of each of those. So, and again, it's not for any one family, it's not going to be a huge amount of money, but if it can help some people, I'm all for it. I want it to be flexible, and there are other organizations besides the CAP agencies that could be considered for this, but these seem to be the best designed to do it in an immediate and responsible way. For instance, in order to meet your criteria, maybe we would let the 22 recovery centers, have a pool of funds to help people that come in who are in recovery. That's not out of the question down the road, for instance. But I think for now, the interest in getting it out the door, helping people today, I frankly think this is a good approach.
Ian and
Joe,
then Court.
super,
Oh,
just
go.
point of clarity on what Gordon just said. When we talk about people, are we talking about families who have children?
Yes, I am.
Yes.
Thank you.
And I'm not in disagreement about helping families with children or families in general. So I just want to put that out there. I don't want to sound like cruel. This is what I do for work on a daily basis. I would personally like to see, where it has some impact with the opioid crisis, where they've been affected. That's all I'm getting at. And that there could be a way that they are tied in, or where it plays in that person with that's looking for tires. Is there an impact there for the opioid crisis? But again, I'm not trying to change what the vote was. I'm just stating my opinion. I understand that folks want to get this money out quickly. Maybe I'm not understanding prevention on the whole. However, that's just where I'm at. I want to see this money go to people that were affected by opioids. I thought that was what the money was intended for, and that's where I'm at, and that's all.
Thanks, Miles. Oh, sorry, cut you off, Miles. Okay. Ian, Courtney, are you good?
I just have another quick question. Go ahead, Ian.
Go ahead, Ian.
Sure. So I think I understand there's sort of like who's going to be point on this that we'll figure out later. One question in hearing the conversation today, it seems pretty clear that the committee is talking about direct, flexible supports for families. That meaning not staff time. We're not talking about our own staff time, but staff time at the agencies that implement these programs. And I just wanted to clarify whether or not there was any, interest in staff time, in ways that enable expansion of whole family services to reach more families as something that is of interest here, or we're really talking about just the flexible payments to families. That's definitely what I'm taking out of this conversation, but I just want to make sure that that's correct before we go back. And then the second thing is more of an update and not a question, but just the 30% estimate that I shared with you before, apparently is an estimate from previous years when I asked a couple weeks ago. And Tim actually asked everybody last week what their estimate was, and the number is 50%. So I think just wanted to share that, currently with whole family services, it's closer to 50% not 30%, but that's not currently, that's coming from staff. We're not currently directly asking families about that because, as I think Sue mentioned before, it's not a relevant, it's not like a criteria that would prevent somebody from accessing services. And so we don't, it's not asked because it would create additional barriers. Certainly something we could collect more data on in the future if there's interest in that. We just want to be careful about doing so in a way that doesn't create additional barriers for accessing the services. So thank you.
Thanks, Ian. Courtney, then Chastity.
Ian, my intention was flexible funding for families. I don't know about anyone else's attention, but it wasn't for staffing. My question is there an income limit for this? Like, I'm not gonna say how much I make, but can I go in and apply for the money, or is it people who make under X amount of money? Maybe that's a council question. I don't know.
I mean, we can determine that. They may have limits on their programs now, and it might be 200% of the poverty level, but we can make that, we can decide that one as a council.
We can put that in the contract. That the
Okay,
intent
I don't
is
know.
for
I don't.
families. Yeah.
I don't know the answer to that. I know that I probably at my income level shouldn't be allowed to go apply for $250. But I don't know where the good line is. So that's a floating question.
Correct.
Well, we're certainly used to lots of income guidelines, aren't we, Sue, at our world? So, you know, I think if the council wanted, and you too, Ian, you know, that could be part of the contract for sure.
And maybe I'm totally wrong and people, we shouldn't put any limits on it. That's another question.
I think we should put limits on it.
And
do you have a limit suggestion?
No, I mean, I would look to other folks, you know, from that the CAPS and TANF already have, and using that as, I mean, in terms of like, if we're talking about this money, I think there's a need for direct flexible funding for all sorts of things, right? But if we're talking about this as a prevention method, and the prevention method is supporting families who are economically unstable, I would put a 200% of poverty line, like, or putting it at around the same that TANF has, like these other projects that already exist. But I also would look to Sue and Ian and others to share with us what they think is the right number for the flexible funding.
But Courtney, are you talking an income limit? Are you talking to a limit to how much money we will give each family?
Oh, I guess that's both. I was talking about how much money you can make to apply. So how much money, like, can you make over $100,000 a year and apply for this money? But also, I guess the question is there a limit per family too?
I would suggest not limiting the organizations per family. I mean, problems arise. It's just, I think an income guideline might be important, but I don't think limiting the families themselves would be necessarily necessary.
Could maybe Ian provide us with a couple options at the next time we chat? I don't know if I'm comfortable with the TANF guidelines. Those are pretty low. Maybe there's a next step up.
Yeah, and just to be, there's lots of, I think as folks know, there's lots of different eligibility guidelines for lots of different things. So for receiving TANF cash assistance, for example, is different than the 200% FPL that I talked about for being eligible for the TANF funded whole family services. I think some things to consider, if I think some sort of limit like that is common. The different FPLs or federal poverty level limits that are sort of out there are, 200 is the current whole family services limit. We have other programs here that are slightly higher. like our HOPE program, which is higher opportunities and pathways for education. That is 225%. And I can share some numbers. They all depend on family size too, is the other thing. And then Maine Care now is expanded for kids up to 300% of the federal poverty line. So, you know, for a family, you're talking about anywhere from 5,000, 300% is from like 5,000 to 8,000, depending on family size per month. 200% is closer to like $3,000 to $5,000 a month. So I think all of those are under the 100,000 that you provided, but the family size is what sort of drives a lot of that. And again, you know, you sort of have different standards here, but 200, 225, and 300 are all at play with different programs that we administer right now, with Maine Care being at the most recently increased to 300% for kids, lower for adults.
Just to keep this conversation moving, maybe Mary and staff could sort of like do some digging in and add some suggested numbers to the contracts that the group could review. I mean, time's a tick and it's 4:15, so does that make sense? Okay, Chastity, you're up. And then Gordon.
Just the income guidelines, just to add a piece on that. I don't want to focus too low on the income, because the reality is most Mainers are one paycheck, like loss of a paycheck away from being homeless themselves. So even if someone makes 60,000, who on paper looks like they're doing well, like they may not be and really need 250 or whatever. But my question was on something different. I'm looking at a program down here that the CCC does, the Hope Fund, and it's aged for families with children 0 to 8. Do the other programs have an age limit? And if so, can we make sure that it's like up to 18, anyone with children, and not just young kids?
We, CAP agencies work with families with children up to 18. And through our TANF contract, our whole family's TANF contract, is up to age 18.
Yeah, that's our interpretation too, with the exception that Maine Care recent expansion now groups 19 and 20-year-olds in the same category as 18 and below.
Great. Okay, Gordon, your last question, Gordon.
Couple comments.
Go ahead, Gordon.
Can you hear me?
Yep.
Okay. So, number one, I don't speak for the governor on this. Number two, I don't support an income limit. Here's why. There is stigma. As soon as you talk about an income limit, then you were talking about an application. This is supposed to be flexible, low barrier help. If for the one person who may abuse it and get new tires, I'm willing to excuse that in order to make it easier for the 1,000 people who really need help quickly and aren't going to fill out a damn form. And it's stigmatizing. I look at how our food banks go. Some of them really go well when honestly anyone can go in, and people don't really abuse it. So enough said. I don't think we should have an income limit.
Well,
Gordon just changed my mind.
You just, I totally agree with you. You just, again, it's, you know, I helped somebody fill out a food stamp application and they didn't qualify because they had $5,000 in the bank. And the reason they had $5,000 in the bank was the beginning of the month and they hadn't paid all their bills yet. They were back in their rent. They just got employed. They had a $10,000 credit card bill, and food stamps. The person who's helping them fill out the thing said, "Don't even bother." That's all they had in the world. They had nothing. They had no car. They have no anything but this money that partially was given to them by family. And they were told until they spend it down to $2,000, they couldn't qualify for SNAP. And again, this person lives on a fixed low income. They're a senior citizen. And the person refused to fill out the application because that little bit of money she had in the bank, all she had in the world, she was going to have to give up. And I think income is relative. I can't imagine anybody with a big paycheck wanting to come in and ask for this money. I think Gordon is right. It takes a whole lot of courage to walk into a building and say, I got nothing here. And if somebody helps me, I'll continue to be where I am, and I need to get to my job or whatever that is. So although it was an interesting conversation, Gordon swaying me that maybe we should leave that out.
Well, I'm glad you raised it, Gordon, because my next thought was going to be self-attesting, like, because it's burdensome, it's painful collecting income information. So I'm good with the whole process because it is very stigmatizing, and it's, we're doing this in tandem with our other work, and it's very time consuming, and often people don't leave with sort of money in their hands, which defeats the purpose of this money, I think. But Gordon, did you have other questions? No. Okay. Sue, go ahead.
I was just going to say, Joe, that related to what you just said, Community Action in Maine just was received diaper distribution research funding through the federal government. And one of the criteria in the funding is that a family is low income, and then that was identified as 200%. However, they removed the need for any family to provide any backup documentation. So basically this is what's in the information that's distributed, but as families come in to access diapers, that's never asked. It doesn't matter if they make $5,000 a month or $10,000 a month. If their children have a need for diapers, they're going to be able to access diapers through the distribution program. So we certainly are used to working within income guidelines or not, depending on what the funding source requires. So thank you.
Well said, Sue. So as we wrap this sort of portion of the meeting up, I think if Mary and Ella can sort of work on contract language, I do think that there's an urgency. People are really suffering. So I think the quicker we can move this along, I think the better it is for Mainers. So I think if we can move this along and then we can circle back. And then Ian, keeping you in the huddle. I mean, you're the long-term guy. I mean, you're going to be funding whole families, hopefully for a long time. So Mary and Ian, can you guys work on something? And then get it back to the group?
Yes, most definitely.
Okay. Thank you very much. Thank you, Sue and Ian, for your participation today, and you're free to continue in listening to the meeting and or
Awesome.
participating. Mary's going to talk about the application process now, or an application process or the process. So go ahead, Mary.
Great. Thanks for having us. See ya.
Great. Thank you, Ian. Thank you, Sue.
Thank you.
All right. So to change gears a little bit, I'm hoping to chat with you all about the grant application, which, as you know, Elle and I have been working to develop. We've been meeting with a few other states to hear about their processes, which has been very helpful. And in doing so, we've learned a little bit more about their process for actually drafting and going about the publication of an application process. And so one of the big topics on my mind and that I'm hoping the committee can discuss, because I don't think that we can move forward confidently in our drafting of the application without a clear understanding of where the council stands. And that issue is on the priorities. And so more specifically, how the committee and the council plans to integrate funding priorities into the application process, and how that whole piece would like to be talked about in the application. And so I guess to kind of, I understand that that's a pretty big picture question. And I do want to have a discussion around it. And again, I'm happy to answer any questions, but I think if the committee can start with just kind of talking about what everyone's thoughts are around defining the priorities of the application, specifically if that's separate than funding the council wants to move forward with, or if that's in line with the 4 pillars, that sort of thing. So there's already hands up. So Gordon, do you have a question?
Yeah, yes. I'm only one member of the council. I'll just give you my thought at the 30,000-foot level, because I've talked to Mary, but I may have talked to some of you about it. I don't like the idea of an open-ended application. We've got $15 million, send in a one-page proposal on what you think we ought to do with it, something you could do with it. I think it would be much more meaningful and still very open to anyone if we issued different applications or requests based upon our pillars of prevention, treatment, harm reduction, recovery, support, and put some parameters around them. For instance, we might say, we're really, and this would be based upon gaps that we found in our prioritization. So for instance, one might be in recovery support, which we've really done nothing on recovery support except Sangerville. We might say, we're interested in proposals to incentivize individuals who would buy, renovate, construct, build, and operate a recovery residence in counties that have fewer than 2. Frankly, that would include Washington, Aroostook, Samoset, Franklin, Lincoln, and Piscataquis, and Hancock. There's none in Hancock. So, I mean, that's just an example, because that would give us meaningful applications from people who, then we go into phase 2 and say, well, could this organization really do this? But it would, I think it's a way to give everybody a chance. And we could identify enough gaps that almost everybody would find that. And then we could have an open-ended application for anything innovative that doesn't fall into one by gap. And we'd say, we're setting aside $1 million for innovative projects and then put up parameters we want about it. I'm not going to say another thing because, I talk too much about it, think about it too much, but those are my thoughts.
You're muted, Joe, but I think I read your lips as Chastity.
Yeah, Chastity, Pat, Courtney.
Sorry, I've been typing, so I did not read lips. I agree on the 4 pillars part, but I don't know. I think I'd like it to be open and just have the 4 pillars, because there might be something really great that someone else brings to us under a pillar that isn't even on our radar. And so narrowing it down even more worries me about some really cool stuff we could miss. And that's it.
Thanks, Chastity. Pat.
So I like Gordon's approach to that, with a sort of a caveat that I do, like Chastity said, I think the grant applications have to go under the 4 pillars. But I do think that when you're putting out the application, you have to have some specificity to it in some way. As someone who sat on a grant process that was too open of an application, it became you're just going to get a lot of stuff that there's a lot of time involved. And I think there's a way to do innovative programs. I think you can have an innovation grant process that where people with very different ideas can go with that. But I think we need to look at gaps, like he said, and look at, what are those gaps and put out specific applications to meet those funding gaps that nobody else is doing. And I think you're going to get a much more clear idea of what people are asking for and how they're going to institute those funds, than to have it just open-ended. But I still think we can do innovation, that we won't lose people for having clever, or innovative ideas in order to get people into recovery or treatment or wherever that pillar may be. But that's just my thought. But I think you don't have it narrowed down, which sort of leads to Mary's thought about the council really has to say what are some of those priorities in order to do that.
Thanks, Pat. Courtney.
I really like Gordon's idea around the pillars. And also I think the specificity that Pat is talking about, I'm sorry, I don't like that word. But the particulars around the grant application is that it should meet the MOU document, the outline allowable expenses for the opiate settlement monies. But I think that we should leave it up to people, and for 2 reasons. One, I think that people have really great ideas, and 2, I don't think that this council is going to be able to pick 2, 3, 4 things unless we do another whole round of conversations, a whole day retreat, a whole another voting process, and that's going to kick this application out even farther than it already is. And I think that process around what is our priority can happen through the letters of intents that we're getting from people throughout Maine. So as long as they meet the criteria of what is allowable under the opiate settlement money and our tag to treatment prevention, recovery, or harm reduction, I think that we should leave it open and then allow the priority process to happen through the letters of interest. Oh, that was the other part I really liked about Gordon's suggestion, was instead of full grant applications, it's a letter of interest and a 1-pager, not a budget and all that. That takes a lot of time for small orgs.
Thanks, Courtney. Liz? Or maybe Bruce, I'm not sure the order.
Thank you. I agree that if we set aside money in pillars, I think that's a great idea, because and I wonder if there's a way, as much as I would love to have open-ended, having been on the receiving end and reviewing grant applications, I just worry about the ability to have a fair and transparent process for scoring incredibly different stuff. And I just think we'd have to get really clear, we're not going to fund things that are already funded by the state, or we're not going to, I just think there's all these things that we all know as a council that we've been trying to figure out so desperately, like who's funding what now, how do we coordinate, that the public doesn't, that there are some people, they may not know that when they apply, that oh, that's already happening, or that we now do know, that we may want to consider working through the pillars and coming up with some priorities within each pillar. And as we figure those out, we release a grant application. And one of the reasons I think I was suggesting that we have the Prevention Training Transfer Center have a work group, is that they would help give recommendations of what are the things, looking at the landscape of prevention, of where are those gaps, and then recommend to us, we think you should fund things in these 2 buckets, and then we put out an application that's for those two buckets. And I just wonder if we could do it that way, where we set aside some priorities within the pillars, knowing the pillars will sort of be equal. We come up with an amount that we want. And I love the idea of the LOI, and then I love the idea of innovation grants, so we don't miss anything. And we could perhaps do each county do one smaller grant for county that's for like an innovation grant within a county. So it's so that all 16 get, say, a $25,000 innovation grant, or something smaller that allows those small organizations to apply for something.
Thank you. Bruce?
I think I'm going to just agree with Liz. That's exactly what I was thinking. There has to be some specificity to what we're asking for, that the needs need to be filled. Expecting the public to somehow fill the needs with their innovation is not good planning, I don't think. And I think that's part of our job, right? That we're sifting through all of this information and that we're coming up with our priorities and what we see as what we think are our priorities based on need and based on gaps that we're trying to fill. So I think Gordon's first example was a perfect example of what I think we all know, that there just are not enough recovery residence beds available to people, especially in rural counties. So if we just sat back and waited for people to give us, proposals that are somehow innovative or whatever, then maybe we wouldn't fill those needs. And I think it's critical that we be thinking about where those needs need to be filled and that's what we're asking for. So I think I'm falling behind Liz and Gordon on this. And I think those buckets and then having specific proposals that we're asking for and letters of LOIs that we're asking for, I think is the best targeted way for us to do this, because I personally would like to walk away from this thinking, oh, we fulfilled some of the needs that we identified. And what have we been doing all this work for the last year plus? Hopefully we've identified those needs as best as we can. We're going to miss some things. I know we are, but for the most part, we're trying really, really hard to fulfill those needs.
Thanks, Bruce. Courtney?
So it sounds like there's the will of the council is going to be specifying underneath the pillars, and I'm happy to go with the will of the council. I guess my question is, how do you do that? How do we come up with those things? Because I mean, we had a voting process, but I'm not sure that that's everything that we want to put into these. Who's going to do this process?
Pat looks like she's going to.
So, Courtney, we have a list, and we certainly can send sometime, if it's the grant committee's recommendation, to expand that list. We have an already started list that we went through. We can look at that. Some of them we can actually scratch off that we've actually funded, some of them. But we can certainly take some time, look at that, and change that a little bit. Was there something in, again, sorry. Again, we can do that. I think we can spend the time as a council to say, okay, this was your list that had all the pillars in it, including there was one in there for research too. So there's another one, and add or subtract to that list, and do it in a manner that, is time framed, that we look at from what we've learned, what we know, and look at gaps. I think it's doable, but that's up to the council.
Thanks, Pat. Gordon?
I don't disagree with anything that Pat just said. I want to just mention two things, and one of them is likely to be controversial. There are some urgent gaps, and I want to share something from the state side as a piece of information. Some of you are aware of this, some of you aren't. But it really relates to the motion I made to do 10 up to 10, at least 10 detox beds in Franklin and Androscoggin County, right? People are watching that, 50 people, 100 people. People just think now that will happen and we'll get those beds open. The state put out money, state money, to do beds in Washington County and Kennebec County. I'm not gonna say anything about Kennebec County, but both of the time periods have expired. And in Washington County, where I've heard nothing for 5 years but the need for detox beds, no one applied. People came to the informational session. There were credible organizations, partners up there, but no one applied. So I really worry, and we've done a tremendous amount of work on, over the months and years. So all I'm saying is when we drop even the proposals that we have advanced, we have to be prepared that we need credible partners and organizations that can actually do the work. So that's one point. My second point is that I think we should have a discussion about, and I think in terms of the priorities, secondary priorities and things, we can do that in either the grants committee or the full recovery council. But I do think there ought to be room for some sole source contracts and in really high need areas, because now I'm afraid it's the only way we're actually going to see a viable project. I've told the governor, you know, if we're going to have 10 freestanding detox by the end of your term, we better start 20, because 10 of them aren't going to make it. So again, I've already said once, I'm not going to talk again. But so I'm going to sign off momentarily at least. And thank you.
Thank you, Gordon. So I think again that if, you know, Mary, Ella, and team just like keep working and I can help and pack. And I mean, I think just let's keep it moving. I do, you know, there's limited staff resources. So like it's now the end of February. We're still working on the December, you know, so I think that it's a lot. It's a lot for this committee to meet every 2 weeks. It's a lot of work. So I think we have to be realistic about what we can actually deliver. But I think if we can ask Mary and Ella to continue working, and whatever we can do in the meantime, we'll Pat and I can and others can help. Liz, go ahead.
I'm wondering if there's a way, you know, we had a list going that the group came up with, and I'm wondering if there's a way to put that list into a spreadsheet in which those who are really familiar with projects that are happening or gaps that exist, we could put some of that information into a spreadsheet in which we perhaps then talk about those things here in this space, where we kind of work through some of the things to talk about what are the priorities. Because I feel like when we get to full council, we're like, okay, what do people think the priorities are? Like lots of people have lots of opinions and lots of things to share. And I wonder if we could consolidate some of that to doing that work before we get there, so that people could read through stuff and understand like, okay, the state already is doing XYZ for treatment, and here are things that are missing, that we kind of, so that we can have a really a knowledgeable conversation where we're coming up with those priorities based on, you know, people having been able to have their input in that before we get there. Because it feels like people have to like shoot in. They're like, wait, but my thing is really important. And it should be about like, what are the gaps and how do we identify those perhaps ahead of time, and what are solutions to those gaps? And I know we did some of this. So using what we already did, but putting it into a spreadsheet so people can add information, like here's what's being funded, not being funded. And things like that, so that, because I felt like even when we voted on stuff for prevention, like people were looking at me like, will you do prevention? Tell me what you think. Well, I think we should all, like, I want to share with everybody what I think is happening and what the gaps are, and then have you all decide, what do you think we should spend money on based on that, you know, not like tell you what I think, but really about fixing those gaps.
So Liz, I just want to inject because I have to leave in a few seconds, but that you're right, that list somewhat exists. There's a spreadsheet that we have that Mary and I can work with Mary and get input from others as to how to expand that spreadsheet. So we can have that spreadsheet available to pass around to council members and to other things, so we can do that. But you're right, that spreadsheet is already started. We can look at it and expand it so that we know the answer to those questions, because so other members of the council can have that full spreadsheet when they're looking at priorities and where we go for gaps.
Great. Bruce.
I think I'm just going to agree with Liz again. I hate being held to that kind of exercise that we did. It was haphazard at best, not scientific. We certainly didn't have the same kind of ideas about what the needs were. We didn't have the same amount of information. And I really like the idea of kind of, hopefully, we're going to attack this pillar by pillar. What are the needs within this particular pillar, that we all have this discussion together. And we all identify maybe some of the things that are already being addressed by other funding sources and so forth. Yeah, and I guess I'm just going to say again, I just wasn't a huge fan of how that process. It didn't feel right. And, some things we identified and it was great and it's worked out. I think the first things that we voted for, but I think it's the second level and third level things that need a lot more discussion. And, last thing, I think Liz is on to this, that it's our job as this committee to sift through this stuff and bring it back to the larger committee. Because if you've got 15 voices and we're all trying to sift through this, it's going to take forever.
Thanks, Bruce. Courtney.
I just want to say that I 100% agree with Bruce on that. I also don't want to be held to the second tier of those priority lists. I'll leave it at that. I just think that we need another process or another conversation about that second tier, and that the first tier was the unanimous vote that we saw in December. And hopefully we can get to another unanimous vote through conversation and understanding.
Thanks, Courtney. So we need to get the agenda. Haley is needing that ASAP for next time. So one of the things that's sort of getting in the way of sort of this conversation is sort of like closing out the existing projects. So can we agree next time that and Pat, you and I can work with Mary and that sort of to come back next time and say, done. We've here are the contracts. We'll get them out as soon as we can. And then we can move on to other conversations. Does
You're
that
talking
sound?
about the grants committee or the full council
The
meeting?
grants committee, Gordon. So like 2 weeks from today, when the grants committee meets, so we still have SSPs, that contract, the youth prevention, the caps. So can we sort of have a final conversation? And I'm not even talking conversation, a final review of contracts. Does that make sense, Pat and Mary and Ella? Okay. And then do we want to get to sorry. And Ella, I know your hand's up, head up. I'm so sorry.
Oh, no, that's okay. I put it down on purpose. Mary, go ahead.
I I think it would be realistic to have a conversation about those contracts. I don't think it at this point, especially because Brendan is out this week, that we could have a final draft of those ready. I do think there are specific questions that we'll need guidance and answers about. So I just want to set that expectation now that those funding contracts will not be set in stone nor finalized, but I do think it's realistic for us to have a specific set of questions that need answering and also to review a draft of all those.
Okay, great. So I'm going to send the agenda to Haley so we can get it posted. So we will not, so next time, Gordon, we have the Piscataquis folks coming, correct, first?
Yeah. Yes, I've done a 20-minute presentation and I've given them a list of 6 or 8 questions to answer.
Perfect. And then we'll have a kind of final discussion about contracts, Mary, and then yes, we'll do the finalizing. But I think at some point we just have to wrap this up and move on and then talk about all the other matters that we've talked about. I like in the conversation about process and priorities and such. Does that make sense? So Haley, you should have that in your inbox. And then at some point, I think we do have to circle back, if not next time around. We haven't talked about detox bed yet. Gordon, you raised it. That's got to be back on the agenda. Other projects, priorities such that we've just talked about.
For the spreadsheet that Liz had mentioned, and as Pat said, I do have a start to that spreadsheet. And so what I'll do is I'll reorganize it a bit to include a couple more pieces of information and also allow council members to include their input as well. Does the committee want to see that spreadsheet ready for discussion at the full council meeting, or how do we want to start that discussion?
Can we do that here at the Grants Committee?
Sure, and have that ready for the March 19th meeting or for the March 5th?
If you
It'll
can
have to be
it ready-
March 5th to get to the
Yeah.
the council.
Okay, sounds good.
We'll help, Mary. It won't all be on you.
And I just, my comment on today, I think that the whole family's work is fascinating. And as Sue said, she had so much to say, and I know Ian is really smart. He has a lot to say, and that's sort of gets to the presentation path, the list that you sent out. Like they are touching a lot, Miles, to your thought about people impacted by opioids. So I think that's what we want to get to too, to have presentations so that we can talk in this group in a different, more fast pace than sort of, because we're learning a lot. And today was very informative. So that will be next week, 2 weeks from today. The agenda will get posted today. Any other business? We might end early.
All right, well, thank you, because I have to go. Thank you all very much.
Thank you, everyone. Good meeting.
Thank
Thanks so
you.
much.
Thank you, Joe. Great
Thank
meeting.
you.
Great work, Joe. Thank you.
Thanks, Joe. Thanks, everyone.
Thanks, everyone.